when I die, you better second life.
What was once thought to be a death sentence is now being considered a second chance at life. Who are these people? Where do they come from? Where do they live? Just few of the questions being asked by viewers like you who want to know. But in reality, do you really want to know? There are your bankers, your clergymen, the friend next door, your brother, your sister, and yes, even your mother and your father. Here's my point. With Louisiana ranking number 1 once again for AIDS and number 3 for HIV, don't you think it's time to say enough is enough? You might think because you don't do drugs, you don't have unplanned sex, and you definitely won't be drinking any breast milk, which are just 3 of the ways to become infected with HIV, that this problem really doesn't concern you. Well, these are real people with real case situations that has changed the lives of many of the people around them. This is a very sensitive topic that we will be dealing with in the upcoming weeks, so we will treat it with the utmost respect as well as our participants.
How you all doing? My name is Ronnie Bluford. I am a HIV survivor of 32 years. A long time ago, I was a promiscuous individual. I lived a life of drugs. I did intravenous drugs, and I was sexually active and unprotected sex. I was diagnosed when I went to penitentiary for a short while, and at that particular time, I was given medication. But after I got out, I got right back into the lifestyle of drugs and women and frolicking. This went along for quite a while, I guess for right at 12, 14 years before it took a toll on my body. I started getting sick. That was many times that I was confronted as to whether or not I was HIV positive. And I never denied. But for some reason, people still came to me or dealt with me because I was also trying to kind of like make it easy, protect myself. I mean, I didn't use anybody's needle. I was known to have packs of new syringes. I was known to use bottled water and to clean my utensils with bleach, and I kept hydrogen peroxide. I used all kind of means to protect others and myself. But the fact when it was brought up about me being HIV positive, I never denied it. And still people progressed toward me, thinking that, seeing what I was doing, thinking that I was doing what was right, and they kind of followed me. But after a while, I realized that these things may have hampered the progression, but I still was infected and was possibly infecting others. There came a time in my life that after 10 or 12 years, I realized that I needed to do something. I needed to do something to better my conditions, and so I quit. I quit shooting dope. I stopped shooting dope, but I still was in the drug arena. I then picked up smoking, and then not being totally aware that even through the mouth, through I was smoking, but now everybody doesn't have a clean. Nobody has a clean mouth, and that not knowing that through small cuts or tears or lesions. You know, there's a lot of things that can indicate that your health is bad, and that you can transfer the virus. But until I got educated on the do's and don'ts, I did continue to be possibly a passer on of the virus. You know, this is something that I live with. I think about it from time to time, but I don't let it despond me and cause me to be depressed. I mean, because these are things that I've done, and as I said, I'm not even aware as to how I was infected. I may have been infected through a needle. I may have been infected through unprotected sex. I don't know. But it's what I know now that counts, that matters. And I try to live a life that portrays the individual that is aware and knowledgeable of what to do and what not to do concerning HIV. Well, I guess I have a very strong family. I have a first cousin who is I could prefer to refer to him as a big-time doctor. He's at MD Anderson and has been there over 30 years. And when I first suspected that I had HIV, I consulted with him when he was here for a few days. And he was not able to confirm, but he relayed to me that I needed to be checked. And he was not, he didn't condemn me. He was supportive. As I said, he gave me positive information to what to do. As far as who I live with, I live with an aunt, and she has been open-armed and never been condemning of me of what I do, and has always been supportive with what I'm doing. And I mean, we eat at the same table, we eat from the same place, and of course I share information with her, but I'm also protective, and I make sure that I do things that will not affect her, that I won't pass on the virus to her also. And I must say, I mean, she's in her 90s, and for her to have the mindset that she has, she gives me strength. In other words, my family has been very supportive and made me strong. It has not been something that I haven't shared with the bigger part of my family. We have a family reunion every 3 years, and I have acknowledged and have spoken openly at my family reunion. So everybody in my family, be from here to wherever they are in the United States, has knowledge of Bluford has HIV. The church has always been, I guess I want to say, low key. It's not that independently I went to my pastor and acknowledged what's going on, because I was trying to recruit them to become a part of different programs that are going on. And all I can say is that not just my church, but many churches are standoffish when it comes to getting directly involved. It's a necessity for us to open up. The churches must open up. The churches are where we find, this is the resource of a lot of information. There is no program or programs developed to address HIV at my church and many churches. There are some that do, but not at my church.
To our pastors out there, let's lead by example. If you're afraid to talk about sex and HIV from the pulpit, call me. I'll do the sermon. I'll talk about sex. I'll talk about HIV. Because sex is in the Bible from Genesis to Revelation. So if we're afraid to talk about stuff that's in the Bible because of what members in the congregation that's been there for years might say or might do, because they might leave the church and some of the tithes and offering might go with it, then we're saying we're afraid to do what God is calling us to do. And the Bible says that don't lean into thy own understanding. If you reject knowledge, I will also reject thee. My people are destroyed because of lack of knowledge. Then that means that if he calls us to do something, we're supposed to do it. But you know, if you don't want to do it, call me. And then when I get through and I didn't put it on people's heart to get tested, to know their status, to watch what they're doing, to let them know what HIV is, and they still don't like it, when they complain to you, you can tell them, I don't know who that is, but he won't be there anymore. Because I'll take the fall. I'll educate another person. I'll tell the facts. I'll make people think about why they're part of the problem. And the second thing is, get tested. How can we walk around today in 2013 and not know our HIV status when they have free places to get tested? And even if you have money, we have over-the-counter tests at Walgreens, Walmart, Rite Aid. It doesn't matter. Any pharmacy just about carries an over-the-counter test for $40. If you don't want that, spend a little extra money. Call Baton Rouge AIDS Society, 923-AIDS. We do 24-hour testing, 24/7, 365. Any day of the week, you can get tested. Even at your own home, you can get tested. So what's the reason? Because we're number one? Because you're scared of the stigma? Because you just don't want to know? But all those reasons can cause you to get a late detection. And if you are HIV infected and you spread it to other people, or you HIV infected and you don't get the treatment in time, then you're not just shortening your life, but you're shortening the life of the people that love you as well.
I'm a lifelong citizen of Baton Rouge. I've seen people come and go. I'm beckoning to all in Baton Rouge that HIV is not a death sentence. HIV is no different than cancer, tuberculosis, or any other disease that has to be dealt with. It's something that's not going to just go away. So I'm pleading that people get involved, that they need to know. There's only one way to know, and that's to get tested. And don't fear to have the knowledge. You need to have the knowledge for this particular condition could be incubating in your system for 10 or 15 years before it surfaces. So it could be something that you did 10, 12, 20 years ago.
The virus, when it infects our body, it kind of goes and takes over what we call the nuclear material of the cell, and it replicates there and replicates, and after a while that cell gets full with viruses and it bursts open into the whole blood, and those new viruses now reinfects all the new cells, and that process just keeps going. First of all, you have to make sure that you get access to care. That's very important, and that you find a good doctor or clinic that is specialized in treating people with HIV. A lot of times you need counseling, somebody to sit down and explain what the disease process is, and the fact that there are resources in the community that can help treat the patients. The fact that the virus is no longer and does not need to be a killer virus anymore, because we do have treatment. That's where you start. If that mother can get into a physician or a clinic that will take care of that mother's HIV status, my advice would be for her to start the treatment of HIV as soon as possible, and that will most likely prevent the child from getting HIV also. It's, a topic that sometimes gets infectious disease physicians excited, and then, it's like a roller coaster. But in terms of cure, I'm not sure. Because we have, you make progress and then you find out that, okay, it's not as much as you thought it was. There have been a number of cases recently that have been very gratifying. The case of the little 2-year-old boy in Mississippi that was apparently, they started, high dose treatment, and the boy is now seemingly functionally cured. That's a case for hope. There are a few cases I've heard of, but not here in America, where they actually did stem cell transplant and they seem to be functionally cured. But we're still a ways. What I do need to say is that it is still not the killer disease it was 30-something years ago when we first came to know more about the disease. This is now totally, you're able to control it and treat it as a chronic disease. Just like hypertension, high blood pressure, we don't have any cure for high blood pressure yet, but people's blood pressure can be controlled on blood pressure medication. That's where we are with HIV now. At least we can say we are in control. If a patient is HIV positive, what they need to do is find an infectious disease physician that can take care of their HIV. I mean, there are issues with treatment, but then the physician can troubleshoot it with the patient. But it's totally a manageable disease now. You could be down to as little as 1 pill a day. We have, right now as I speak to you, three different regimens that have the complete therapy in that 1 pill once a day. That 1 pill contains at least 3 different medications in the 1 pill combination once a day. That's how improved we have become. The cost is an issue, and that's why, people need to be in different programs. I would tell you, as a physician that sees patients with different kinds of insurance, Medicaid pays me the least, I would say, but I'm happy to treat the Medicaid patients because I can get the medications, I can get their labs. What's the use of treating somebody if they cannot afford the medicine, or they cannot even do the simple labs to monitor what you're doing? You don't want to be treating somebody blindly in this day and age, in this part of the world. The people that I find with more issues are the working poor who have insurance, but then the insurance may pay maybe 80% of the medication. If you think about it, if this medication costs $1,500 a month, what is 20% of that? In addition to the patient's other bills, a lot of times it's a problem. I try to, get them in different programs, and the pharmaceutical companies have been trying to give us discounts for such patients, but it's still some group of patients that we have problems trying to get them their medications or their labs because they have co-pays and they can't afford it. I think that being younger, if you look at the population 25 to like 34, there's still a lot of unprotected access going on there, and I think it has to do with youth and feeling indestructible. And then, oh, he told me he doesn't have anything. You just believe the person. Well, that person may actually not know. A lot of people, maybe as much as 20% of people with HIV don't even know their HIV status because they've never been tested. So he told you he doesn't have it. He may be thinking he doesn't have it. He never got tested. How do you know for yourself? This is about your life. And I think each and every one of us should be responsible for ourselves. It's not enough that somebody told you they're not positive, or you actually, even if they told you they're negative, why don't you go and do the test together before you do this thing? There's what we call pre-exposure prophylaxis. Again, this is not to encourage people to be promiscuous. It's just to if you love somebody and you want to be with them, you can still protect yourself from not getting the HIV virus. You can be placed on a pill once a day while you're with this partner who may be your spouse that is HIV positive and you've decided to stay together. You could take a pill once a day, and that would prevent, most times, the virus from taking a foothold on you.
You need to know. Knowledge is power. And I've always been taught that without knowledge, and once you have knowledge of something, then you can work on it. And there are many available resources to combat. There are scientific breakthroughs going on constantly, you know, and that as I am a living statement, that it's not a death sentence unless you make it. You make it a death sentence.
Never could have made it without you. I would have lost it all. But now I see how you were there for me, and I can say, oh yes, never would have made it. I never could have made it without you. I would have lost it all. But now I see that you were there for me. And this is what I can say. I'm stronger. Anybody stronger? I'm wiser. I am better. Yes, I am. So much better. When I look back on all the things he brought me through, I can lift my hands and say, Lord, I thank you for bringing me through. Is that your testimony? Come on, help me say, never would have made it. Never could have made it. Never could have made it without you. I would have lost my mind, but God, you kept my mind, and I gotta give you glory and honor and say I never would have made it. Oh, never would have made it. I never could have made it. Never could have made it without you. Oh Lord, we've got to say thank you, Lord, for all that you have done for us. Oh, and we can say I'm stronger, I am wiser, I am better because of what I've been through. I'm better. Oh God, I want to say thank you. I gotta say thank you for all that you have done for me. Oh, it was you that pulled me